Welcome all to the admissions talk of Bachelor of Science in Speech and Hearing Sciences. I'm Dr. Estella Ma, an admissions tutor of this program. So in the coming 15 minutes, I'm going to give audience an overview of the profession of speech language therapy. And I'm also will guide you through the curriculum of speech and hearing sciences at HKU, and followed by the admissions requirements, procedures to apply for this program. After my sharing, I have invited our current students and also graduate to share with us their experience and also highlight of taking the speech and hearing sciences at HKU. So let's start by looking at the profession of speech language therapy. Speech language therapists provide diagnosis as well as treatment to individuals with communication disorders, hearing disorders, and also swallowing difficulties. Our clients, they may have speech sound difficulties. They may have difficulties in understanding language, as well as producing language. Some of them may have reading difficulties and also writing difficulties. They may have husky voice, so they may not have a clear voice. They may have a breathy and rough voice as I'm talking to you with my voice. And also they may have hearing and also swallowing difficulties. Now, one of the fun parts to be a speech language therapist is that we don't work alone, but we work with different disciplines. Apart from the clients and also the family, the caretakers, we also work with different professionals, including teachers, including medical doctors, nurses, teachers, PT, OT, dietitian, etc. So it's really fun to be a speech language therapist. We work with people across the lifespan, so from newborn babies to the elderly. And these are some of the clinical populations that we work with, including autism spectrum disorder, Down syndrome, people with intellectual disabilities, people with stroke. They may have difficulties in understanding and producing language, and also people with cancer, such as those with laryngeal cancer, head and neck cancer, nasopharyngeal cancer. So those who may have developed speech and swallowing difficulties after the cancer treatment. We work in different settings. And these are some of the examples, such as government organizations, including the Department of Health, Education Bureau, preschool centers. We also work in mainstream, special schools, and also university settings. Non-government organizations. Many of us also work in nursing homes, hospitals, as well as private clinics. Now in 2020, all graduates from our program, they are employed. Those who are not employed, the 2% is not because they are not employed, but because they have chosen to pursue further studies, doing research postgraduates. This table shows the employment sectors of our graduates. So where do they go after they graduate from our program? As you can see from this table, the majority of our graduates work in the community, social, and personal services, so such as those NGOs, nursing homes, and private clinics, followed by educational institutions, including the mainstream school and special schools. And some of them work at the hospital authority as well. For the monthly salary, in general, it's over 30,000 Hong Kong dollar per month. And I would say it's very encouraging. So by now, you may ask, speech language therapy feels like a very suitable program or suitable profession that match with your passion, match with your interest. So now you may ask how to become a speech language therapist. And the Bachelor of Science in Speech and Hearing Sciences offered by the HKU here for you. And this program is a full-time program for 5 years. And I want to guide you through our curriculum very quickly. Our program takes the translational learning approach. The goal of our curriculum is to train our students to become an independent and also critical thinker. We train our students to be able to integrate and apply the knowledge and skills to provide speech evidence-based practice, as well as person-centered services. And one of the highlights of this program is that we train our students to have the ability to pursue lifelong learning, which we thought it is one of the very, very important attitude and skills in becoming a competent speech therapist. So this is the curriculum structure. As you can see, the program offers a solid theoretical background in typical development and disorders in speech, language, swallowing, hearing, as well as the knowledge in related disciplines such as medicine, psychology, linguistic, health science, and also hearing sciences. Now you can see the first 2 years are more foundation. So we provide students with those background information, background knowledge on typical development in different communication aspect. From year 3 onwards, the course focus on different types of communication disorders. And then in final year, students have to do 2 capstone courses. One of the capstone is the research in human development and communication disorder that I'm going to talk a little bit more in a minute. And secondly is the advanced clinical practicum. Here. And also in the final year, we focus a lot in strengthening students' interprofessional practice. So they have a chance to really work with students from other faculties, other disciplines such as medicine and nursing. So that strengthen and prepare them to become a competent working colleagues with other disciplines once they graduate. Now for the delivery methods, our program, the courses and the clinic, they run parallel with each other. And we are very confident that this arrangement, this kind of parallel arrangement, parallel structure, help our students to better apply the, and also bridging between their theory with the practice. So as I said, the final year research project is the capstone experience, capstone course. Each student in our program in the final year, they have to complete a research project. They develop a research proposal together with the final year project supervisor, and they have to write up a research report. So everything starting from developing the research topic, preparing the proposal, applying for research ethics, pursuing data collection, analyzing, interpreting the data, and writing up the research report. And then at the end of the whole year, after they've done the research report, they have to give a presentation to disseminate their research work to the public. So that presentation is open to the public. And I have to say that the final year projects from our program, from our students, they are rated very highly by the general public, as well as our program external examiner. And many of them are actually of the publishable levels. So these are some examples of those papers published in international journals that are based from and developed from those final year projects of our students. Clinical practicum. Now, clinical practicum is one of the highlights of our program. And for all our students, they have to complete more than 300 hours of direct client contact under the supervision of an experienced clinical educator. The clinical practicum is held in different settings, including the internal clinic, that again, I'm going to show you in a minute, external sites such as nursing homes, mainstream schools, NGO, special schools, etc., as well as hospitals. So the overall aim of the clinical practicum is to emphasize evidence-based as well as scientific practice. This is the internal clinic of our program. It's the Speech, Language, and Hearing Clinic at Kennedy Town Center. And the clinic has extended and also expanded in May 2017 to provide more clinical learning space for our students. Not only that, but also we now house much more state-of-the-art facilities for our clients as well. Now, the Speech and Hearing Sciences, this program is fully endorsed by the Hong Kong Institute of Speech Therapists, and graduates are qualified as speech therapists upon graduation. Our graduates, they are eligible to apply to be member of Register of Speech Therapists accredited by the Department of Health. And now I would move on to talk about the admissions requirement and also the application procedures. So for the coming year intake, we have 48 places. There is not a fixed quota for JUPAS and non-JUPAS applicants. All applicants, no matter you come from the JUPAS stream or the non-JUPAS stream, you have to attend an interview. And please do include a personal statement in the application. Let's first talk about the JUPAS admissions requirement. We only consider applicants who have put our program in their Band A choices. Okay, so for applicants, if you're really interested in our program, please do remember to put our program in Band A choice. Okay, we count best 6 subjects, including, and we require all applicants to have at least level 4 or above in English. Okay, now one slight change with the admissions requirement this year is that this year we will take away the requirement of BSc biology or combined science with a biology component. Okay, so unlike previous year, we have requested to take away this requirement, but please note that this new revised requirement is subject to the university's approval. Okay, so again, for applicants, if you're interested in our program, please do check the JUPAS website as well as our faculty JUPAS website for updated information on the DSE admissions requirement. Okay, you can also check those JUPAS website for DSE admission scores that from our program in the past years. Now, as I've said, all applicants have to attend an interview. For this coming cohort, please expect the interview to be scheduled from early to mid-June 2022. Okay, so the admissions interview will be held in June next year. It's compulsory for all applicants, and that will be a half-day event, and we have both individual interviews as well as group activities. So the interview is meant to be a chance for us, okay, to learn more about the candidates, but it's more importantly, it's a chance for the applicants to learn more our program as well. So we hope that through those group activities, applicants would learn much more about our program and to find a best match between your interest, your passion with the program. So for non-JUPAS admissions, again, we mainly consider applicants who have listed our program as the first choice. Okay, so for those of you who are doing non-JUPAS and interested in our program, please do list our program as your first choice. We require all candidates to be proficient in both English and Cantonese, including written Chinese. Okay, so similar to DSE, to JUPAS requirement, I have crossed out must have a biology component here, okay, for this coming cohort. But again, please note that this is subject to confirmation. So once we got the approval from the university to take away the biology component for JUPAS admission, this crossed out, this revised requirement would apply for non-JUPAS admissions as well. We consider non-JUPAS admissions case by case, okay, and again, all shortlisted candidates would have to attend an interview. For non-JUPAS admissions, the interview will be scheduled in December, late this year. So how to prepare yourself? Okay, how to prepare yourself both, you know, for the interviews, for, you know, studying speech and hearing sciences at Hong Kong U, or, you know, for you to learn more about this program. There are actually lots of information online that you can search for so that you can get a better information, better idea of what speech language therapy do, including, of course, our program website. You can also learn more about the JUPAS admissions website at Hong Kong U. The Hong Kong Association of Speech Therapists provide lots of very, very useful resources and information about work as a speech language therapist. There are lots of videos and information on communication disorders as well as different clinical populations that I strongly recommend audience, as well as those who are, you know, thinking of whether this program is suitable for you. You can learn more about these communication disorders, clinical populations from those YouTube videos and also online resources. An example is one of our academic staff have prepared a series of you know, short clips, videos on children with speech and language disorders. So please click on those videos and, you know, get more information. I also would strongly recommend candidates to take good opportunities to be volunteer at organizations such as NGOs. They always, if you click on the websites, they would invite volunteers from time to time, and also talk with our current students and also practicing speech therapists. Now, one example is the Speachians Action. Speachians Action is a service group run by our current students in the program, and they have lots of very useful information and experience highlights to share with you. Our program is actually running a taster workshop next Thursday. I've just heard from my colleague from the faculty that this taster workshop is now full. So for those of you who have applied and registered this taster workshop, please arrive on time, take this good opportunity to learn more about our program, as well as you know, talk to our students and, you know, have a look at our research lab facilities. Now, if you have missed this chance, we hope to arrange more taster workshop in the coming future. And please do, you know, check out any websites from these social media, okay? And, you know, follow our Instagram so that you can keep an update on, you know, our future activities. If you have any other questions, please do put into the chat room Q&A or email our program office, and this is the email address. Okay, so what I'll do now is I will pass on the mic to our existing students, our current students, and also our graduate. It's my great pleasure to be able to invite our students and graduates. We have Daryl Chen from year 4, Kathy Look, who is now in final year, year 5, and also Stephanie Ng, who is a graduate in 2020 and now working at a hospital authority. So without further ado, let me stop sharing and I'll pass the mic to Daryl, our year 4 student.
Hello, I'm Daryl, a year 4 speech and hearing student. Thank you, Dr. Estelma, for such an informative overview. And now I would like to highlight some of the interesting parts in my 4-year speech and hearing school life. So this is our class, and we have a really small class size. And guess what? In our program, males are mythical creatures. We only have 3 boys in our class, and here, 1, 2, 3. And by the way, this is me, but you probably won't recognize me. Didn't go to Korea for cosmetic surgery. So anyways, there are various fun activities such as OCamp here back in year 2, as well as semester rise for my own class. To me, it feels like attending secondary school where the bonding is close and the classmates are supportive and caring to each other. And I'm sure that you will also have your own memorable moments in our program. And moving on, this is a teaching and learning part. Like Dr. Estelma just mentioned, we have lectures and clinical practicum. And our program actually emphasizes on bridging theory and practice. So there are much more practical activities, such as hands-on practice. Like in this photo, we were doing a oral motor examinations in our class, and we have role play with simulated patients, as well as some interdisciplinary collaboration with, say, medicine or law or Chinese medicine, etc. And we also have site visits and observations, and something interesting is the video shooting, as well as experiential learning projects. Like this photo here, we are preparing for the school fun day with primary school children. And here, this thing is actually made by me and printed and laminated and cut out all the fishes. And afterwards, I have phobia to fish, but that's another story. And last but not least, Dr. Estelma also mentioned about Speech Action. It's actually our volunteer organization, and it offers many extracurricular activities for speech and hearing students to interact with children with special education needs, like here, and ethnic minorities, as well as elderly. So by acquiring the interpersonal and soft skills in junior years, you will certainly be more prepared for the clinical years and become a competent speech and hearing student. So thank you for listening to my sharing, and feel free to ask me any questions in the Q&A session, as well as the taster workshop if you attended. Thank you.
Thank you, Daryl. And now, well, I would love to be, a student of this program after, having a look at the photos. Very attractive. Thank you. Let's move on to Kathy, our final year student.
Yes, thank you, Dr. Estelma, for inviting me to be here. And I shared quite a lot of same thoughts with Daryl. And because there's quite a lot of experiences in this program, and there are quite a lot of things that are the same as I expected before I apply for this program. First, I expected I will have many hands-on experience, like in the clinic, to work with patients that have the communication needs, but there is quite a lot of things that beyond my expectation. Like for clinics, I expected that, it is just for me to treat the disorder as a speech therapist. But actually, after attending quite several blocks of clinic, I've understood that I have to take care of the quality of life of our patients. For example, in one of my block with adults, my patients have poor swallowing performance, that she might not be able to eat the things that she like, and she can only eat some period like the congee. But after the sessions with her, she was able to upgrade the diet by one level by eating some soft meal. So I think this is very encouraging for me to see that, oh, my patients can improve her quality of life after a session with or a treatment with us as the clinicians. And there are quite some challenging parts of the program. First of all, in the academic parts, there are lots of projects that is quite new experience for me. Like maybe we have to find some parents with the of patients with some communication needs, or like in this year we learned about bilingualism. So we have to find some parents that have with children that are bilingual. And this kind of projects or in other projects, like we have to design some programs to raise the public's awareness in like voice disorder or another swallowing disorders. And this quite required our creativity and also our efforts to finish the projects. But I think it will be fine if we work with our classmates, and we will have to brainstorm our ideas together and try to also apply the things that we brainstorm from the project to our own clinical experience. So I think these are quite great experiences. And then other challenging part is about clinic. As Dr. Estelema has just mentioned, that the lectures and the clinics are in parallel. So at the beginning of the clinical practice, maybe we just only learned about the treatment approaches or the assessment methods just like for a few weeks, and then we have to go to the clinics. So at the beginning, we may have many problems with how to practically carry out assessment or treatment. And maybe we have to have difficulties in thinking many activities to engage our patients, especially the children, in the treatment, or how to communicate. So there are many hands-on skills that we haven't learned or we haven't encountered. And so this is the most challenging part for me. I think maybe we have to take our initiative to ask our supervisors, or just like what I've mentioned, maybe we have to discuss with our classmates, and then we have to brainstorm ideas together and support each other. So I think peer support and taking initiative to ask supervisors are some methods for me to overcome the problems I encountered in clinic. And this is the end of my sharing. Yes. If you have any questions, feel free to ask me. Thank you.
Thank you, Kathy. So you have, share a lot of those learning experience that you encounter, being a student at, SHS Hong Kong U, and very fruitful, and lots of thinking, lots of working with your peers, with your teachers. And I like your sharing that, the clinical sharing, that everything that we work for our clients. We hope to enhance their quality of life. I think that's also one of the very, very important attitude that we want we develop with our students, with our graduates. Thank you. So let's move on to Stephanie, our graduate. And so Stephanie, given that you have already graduated,
yes.
Okay, and now working as a ST at a hospital setting, could you share with us how those, learning opportunities that you experienced when you were a student prepare you to become a competent speech therapist?
Yes, I have prepared a PowerPoint to show everyone. Please give me a moment. Okay. Yep. Okay, so hello everyone, I am Stephanie. I graduated from HKU with a speech and hearing degree for around more than a year now. I am currently working at the Hospital Authority as a speech therapist. So I will do a short sharing about what a ST is like and some of my highlights from the program. So first of all, I hope every one of you here could have a brief understanding on what it is like to be a ST. So what do we do? Well, just by looking at the picture here, you would have guessed. We work with clients ranging from young infants to elders in different clinical settings and institutions. You may find STs working at a hospital, in NGO centers, elderly home, special schools, and even mainstream schools nowadays. You might say, oh, I know, speech therapists, 言語治療師. With the word speech, then obviously they work with speech and language disorders and other communication difficulties. So it was what I had thought before taking the program. But to my surprise, it wasn't that simple. Just as Dr. Ma has shared at the beginning of the talk, the work of an ST also includes providing assessment and treatments to patients with speech disfluency, where some might stutter when they speak, voice disorders caused by vocal misuse, social communication disorders typically seen in clients with autism, 自闭症, and cognitive communication disorders and feeding problems commonly seen in psychiatric patients. And also swallowing disorders, possibly subsequent to neurological diseases, or maybe after surgery and radiation therapy to the head and neck region. So we also work with clients with hearing impairments, repaired cleft palate, and a lot more. So you can see we have really a lot to learn. So what should we expect from this 5-year program? If I have to make a short comment on this, I will call this a step-by-step learning process. In the first 2 years of study, we spend our time learning the basic knowledge, principles, and theories related to the field, such as the developmental milestone of children, the use of Cantonese, and also Cantonese and English phonology. We also had the chance to observe senior students while they have their clinical placements, so we could have a taste of what a speech therapy clinic is like. And in the 3rd and 4th year, we started doing clinical placements. 1 year working on children and the other year working on adults and elderly. We would also learn more about the swallowing mechanism and also the use of instrumental examinations, namely the endoscopic evaluation of swallowing and physiofluoroscopy, like the pictures over here. We also have a few courses designed for us to discuss on syndrome or disorder specific cases. And in the final year, when we gain much more knowledge, experience, and independence, we will have our clinical placement at a public hospital, and we will form our own research to complete a dissertation. So throughout my years of study, we also have some overseas opportunities during our summer holiday. My classmates and I went to Wuhan with our clinical supervisor to provide assessments and trainings to children with cerebral palsy. And we also provided trainings to the children's caregivers and teachers. Some of my other classmates went to Qinghai, and had their placement at a hospital there as well. But sadly, I don't have any of their photos here, but they had the chance to work with children who had just received cleft repair surgery. And another precious memory of mine was when I had the chance to go to London to be a research intern with my classmate. So this was a program funded by HKU. And with the generous support from the professors of the division, we had the chance to assist in the data collection process of 2 research, one led by a researcher at UCL and another one led by a Japanese researcher from a university in Tokyo. So we went there for 2 consecutive summers and we had a blast. So you can see I had a great time studying in this program. And my years of study helped shaping me into a competent ST. So to round up, I have some questions for all of you to think about. So 1, do you like to interact or communicate with others? And 2, do you have good interpersonal skills? 3, do you like to take challenges? Because no case is identical and we form individualized treatment for every patient. And would you be able to take up such a challenge? And lastly, are you able to show compassion, sympathy, and care for the people you serve? Because delivering care with compassion and empathy is vital to all healthcare workers. And are you able to do that? Or do you enjoy doing that? So if your answers to all these questions are yes, then congratulations, you possess the qualities of being a speech therapist. So yes, this is the end of my sharing. And I had a great time working as a speech therapist now. Thank you all.